Welcome to the European Parliamentary Research Service podcast on cross-border threats to health.
Serious health threats do not respect borders. That's why efficient cross-border cooperation and a coordinated response are essential to prevent the spread of diseases or contain public health emergencies.
So, just how ready is the EU to do that? Stay with us.
Public health crises such as the 2009 influenza pandemic or the 2011 E. coli outbreak in Germany show that new infections can emerge at any time and without much warning.
Not only risking loss of life, but also causing economic pressure and upheaval. So how well prepared is the EU for public health emergencies?
Even if the prime responsibility for health policy falls on EU member states, the EU supports their actions and ensures that serious cross-border threats to health are monitored, early warnings issued, and helps ensure an adequate response is given. But to what kind of threat are we referring?
Well, they include threats of biological, such as communicable diseases or bioterrorism, chemical or environmental origins, such as those derived from climate change, or international public health emergencies, such as the Ebola and Zika virus outbreaks.
And because every second counts in an emergency situation, the EU supports the timely exchange of information between member states, as well as sharing best practices in preparedness and response planning.
So, when a serious cross-border threat is detected, an alert is immediately sent through the early warning and response system, allowing member states to share information in real time and coordinate their response.
If the emergency is too severe and a member state feels unable to respond with its own means, it can request assistance from other EU countries through the EU Civil Protection Mechanism.
By pooling civil protection capacities and capabilities together, the EU allows for a stronger and more coherent collective response than individual countries could manage alone. And since its inception in 2001, the mechanism has responded to over 300 requests for assistance both inside and outside the EU.
The joint procurement of medical countermeasures is another example of EU cooperation in this field. By buying common medical goods and services such as vaccines or protective masks, member states benefit from more equitable access and supply security as well as lower prices.
The EU also supports member states in areas requiring a common approach and adequate levels of preparedness and response. For instance, it has put specific measures in place to combat antimicrobial resistance, and it promotes effective and sustainable vaccination policies in Europe as well as globally.
To do all this, the EU relies on structures such as the European Centre for Disease Prevention and Control, which plays a crucial role in identifying, assessing and communicating serious health threats.
Now, how do the different EU institutions work together on this? Stay with us.
The European Parliament has adopted several initiatives focusing both on the general and more specific aspects of cross-border threats to health. For example, during the 2011 influenza epidemic, it called for measures to facilitate the joint procurement of medical countermeasures to improve member states' capacity to respond.
During the Ebola crisis, the Parliament also called for the establishment of a permanent European rapid response capability comprising experts, laboratory support staff, epidemiologists and mobile laboratories, which could be deployed swiftly on the ground.
Aware that climate change poses new cross-border threats to health, members of the European Parliament have also insisted on the need for better preparedness to deal with disasters such as forest fires or floods, and they called on the Commission to strengthen the EU's capacity to prevent and manage global health threats such as antimicrobial resistance.
Member states have also been asked by the Council to increase cooperation on preparation, monitoring, early warning and coordinated responses to public health emergencies, and to work better together to tackle vaccine-preventable diseases.
At the global level, the EU collaborates with the Health Security Initiative in an international partnership to strengthen health preparedness and response to threats of biological, chemical, radionuclear terrorism and pandemic influenza.
And let's not forget that all EU member states are parties to the legally binding international health regulations, which require them to develop, strengthen and maintain core public health capacities for surveillance and response, and to report implementation to the World Health Organization.
So are we ready in Europe?
Well, joint actions on antimicrobial resistance and vaccination are ongoing at EU level, but most importantly, member states seem quite keen on exploiting the potential of joint procurement beyond pandemic influenza vaccines to cover other infectious diseases such as tuberculosis.
Moreover, a joint action on strengthened international health regulations and preparedness in the EU has recently been launched, focusing in particular on countering biological and chemical terror attacks in Europe, working across the health, security and civil protection sectors.
So, as the saying goes, hope for the best, but prepare for the worst.
You're listening to European Parliamentary Research Service podcasts.